Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about cryotomy, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss rationale and aims, learning outcomes, indicative content, resources, submission of evidence, Q&A ideas, evidence ideas, reflective statement, and some helpful tips to make candidates' portfolio better. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into this submodule. Rationale and aims of this submodule outline the general information and expected knowledge and competence that candidate needs to achieve when this submodule is completed. These are relevant to each submodule. For this submodule, the expectations are that the candidate will be able to have understanding of principles and practice of producing tissue sections for subsequent staining and evaluation using a cryostat. Gain knowledge and understanding of processes employed during the production of high-quality tissue sections suitable for routine staining, special stains, IHC, fish. Produce suitable sections from a variety of tissues and will be able to use their knowledge and understanding to recognize and remedy common faults. The learning outcomes demonstrate candidates' knowledge, skills, and competence in this submodule. They also include demonstration of the understanding of scientific principles, laboratory procedures, quality assurance, and professional conduct. They allow candidate to work autonomously and solve problems independently. The first learning is, explain the principles and practice of cryotomy, comparing and contrasting its use with microtomy. Candidate needs to know about cryotomy. Does the candidate know what are the principles and practice of cryotomy? Do they know how they differ from microtomy? Do they know the applications of cryotomy? Do they know the difference between cryotomy and microtomy? Candidate could consider principles and practice like freezing, temperature control, embedding medium, cryosectioning, slides used, staining, advantages and disadvantages, speed, preservation of specific molecules, no antigen retrieval, elimination of fixation artifacts and so on. Applications like investigation of the nature of lesion, intraoperative cases, margins assessment for MOHS surgery, assessment of emergency or accidental finding, confirmation of clinical suspicion, or rapid evaluation. The second learning outcome is, identify and discuss the risks and hazards associated with cryotomes and the difference in risk from microtomy, with particular reference to unfixed specimens. Candidate needs to know about risks and hazards associated with cryotomy. Does the candidate know what are the risks and hazards associated with cryotomy? Do they know how they differ from risks and hazards associated with microtomes? Do they know how to prevent or minimize those risks and hazards? Candidate could consider shared risks like Sharp's injury, repetitive strain injury, ergonomics, different risks like cold burns, biohazards, infectious risks, UV light exposure, fire and explosion risk, aerosol generation, or disinfection difficulty. Safety measures like use of PPE, risk assessments, SOPs, COSH, training, preventive measures. The third learning outcome is, discuss application of frozen sections in cellular pathology, and its role in patient management. Candidate needs to know about application of frozen sections. Does the candidate know why are frozen sections used in cellular pathology? Do they know what are the key applications of frozen sections? Do they know what are the limitations of frozen sections? Do they know what role do frozen sections play in patient management? Candidate could consider applications of frozen sections like investigation of nature of the lesion, intraoperative diagnosis, margins assessment, MOHS surgery, emergency situations, accidental findings, confirmation of metastasis, rapid evaluation, lymph node assessment, specialized tissue diagnosis like for Hirschsprung's disease, neurological or muscle disorders. Role of frozen section in immediate surgical strategy adjustment, avoidance of multiple surgeries, reduced patient anxiety, precise oncological control, rapid diagnostic information during operation, guiding the extent of surgery. The fourth learning outcome is, explain workings of a cryostat and principles of rapid freezing of tissues and discuss how this relates to ice crystal artifact. Candidate needs to know about cryostat. Does the candidate know how the cryostat works? Do they know what are the main parts of the cryostat? Do they know why the tissue needs to be frozen rapidly? Do they know how ice crystals formation is affected by tissue freezing? Candidate could consider main parts of the cryostat like cooling chamber, microtome type, chuck, handle and brake, temperature control, anti-roll plate, UV decontamination, control panel to make necessary adjustments. Rapid freezing and its effects: water and ice crystals, heat transfer, coolant method, temperature management and freezing speed. Ice crystal formation and Swiss cheese artifact, slow freezing, water expanding, water accumulation in extracellular space, deformed architecture, cellular damage, difficult interpretation. The fifth learning outcome is, describe a range of diagnoses that may be made on frozen sections and explain why frozen section is required. Candidate needs to know about diagnoses made on frozen sections. Does the candidate know which diagnoses can be made from frozen section? Do they know why is frozen section required? Do they know the importance of frozen sections for patients? Candidate could consider range of diagnoses like distinguish between benign and malignant diseases, margin assessment for BCC and SCC, MOHS surgery, lymph node involvement, to identify tissue in accidental findings, to evaluate muscle diseases, metabolic disorders, transplant tissue viability confirmation, and many others. Requirements for frozen section like established diagnosis, surgical management and directing extent of surgery, avoiding second operation, confirming tissue viability, enabling specialist techniques like molecular testing, investigating nature of lesion, importance for patients. The sixth learning outcome is, demonstrate preparation of high-quality cryostat sections and include examples of when it would be appropriate to seek assistance, advice, and give the rationale. Candidate needs to know about high-quality cryosections. Does the candidate know how to prepare high-quality cryosection? Do they know when to seek assistance or advice? Candidate could consider their practical skills like embedding, setting up cryostat, cryosectioning, using anti-roll plate, staining cryosections, and decontamination. Situations for seeking help like tissue difficult to cut like fatty or hemorrhagic tissues, persistent artifacts like crushing, compressing or rolling or cryosections, equipment failure, safety concerns and so on. These will be highly training and competency dependent. The seventh learning outcome is, demonstrate, with examples from candidate's practice, how to orientate and freeze tissues appropriately. Candidate needs to know how to orientate and freeze tissue. Does the candidate know how to orientate and freeze tissue appropriately? Do they know the tissue orientation requirements? Can they orientate various tissue types before freezing? Candidate could consider practical skills of orientation of skin samples, tubular structures, muscle and nerve biopsies, oral samples, hollow organs, bisected samples, suspicious nodules, fatty tissue, hemorrhagic tissue, any special requirements samples might have, and hints and tips if they have some. This is highly competency dependent. The eighth learning outcome is, discuss the importance of preparing frozen sections in a timely manner for intraoperative diagnosis. Candidate needs to know about time management for intraoperative diagnosis. Does the candidate know, why is it important to prepare frozen section rapidly? Do they know the implications of not being able to time for intraoperative diagnosis? Do they know the implications for patients? Candidate could consider immediate surgical decision, optimal and rapid patient management, minimizing anesthesia time, maintaining tissue viability and quality, to enable ancillary studies, to rapidly evaluate resection margins, for immediate management of accidental findings, to rapidly assess viability of transplant tissues or organs. Candidate could also consider the implications of poor time management. The ninth learning outcome is, demonstrate decontaminating cryostats appropriately. Candidate needs to decontaminate cryostat. Does the candidate know how to decontaminate cryostat? Do they take appropriate steps during decontamination? Do they know the health and safety considerations for cryostat decontamination? Candidate could consider their practical skills in operating cryostat, various decontamination cycles available, using Hoover, using UV decontamination, the importance of when to decontaminate and why, health and safety considerations of decontamination, following the SOPs. This is highly competency dependent. The 10th learning outcome is, identify problems which may arise during cryotomy and demonstrate troubleshooting as appropriate. Candidate needs to identify and troubleshoot problems with cryotomy. Does the candidate know, what problems can they encounter during cryotomy? Do they know how to troubleshoot them? Candidate could consider problems like wrinkled or compressed section, curling, thick and thin section, tissue cracking, chatter, ice crystals formation, remedies like optimal temperature, sharp blades, anti-roll plate, pre-cool tools, problem identification, corrective and preventive actions, record keeping, monitoring and verification. Indicative content highlights background knowledge that might be assessed during the Viva. They may or may not be demonstrated by the learning outcomes or candidate's evidence. In this submodule, candidate is expected to have the knowledge and understanding relevant to awareness of the main role of cryotomy and intraoperative diagnosis for a range of conditions. Samples that cannot be processed, like fat-related pathology. Health and safety considerations beyond that required for microtomy. Standard staining of frozen sections. Rapid H&E, enzyme histochemistry, and so on. Indicative content also highlights skills and competence the candidate is expected to be able to do. For this submodule, candidate must be able to produce high-quality cryosection within appropriate time frame. Recognize common artifacts associated with cryotomy. Correct common artifacts. Resources section on the Brightspace contains some very useful information for this submodule. Submission of evidence section on Brightspace informs the candidate what evidence needs to be submitted for each subsection. Candidate needs to submit answers to questions that were set by the training officer. I will share some examples of possible question suggestions later on. Candidate also needs to select an additional piece of evidence relevant to this submodule. For evidence ideas, please have a look at the video for trainee. Each submodule also requires the candidate to submit their reflective statement relevant to their practice and training in each submodule. These are some example questions you could give your candidate to test their knowledge, competence, and skills about this submodule. These should be based around the learning outcomes mentioned earlier. These are some more example questions you could use for this submodule. You could ask them to complete tables you created, based on the learning outcomes. Or you could use images to test candidates' knowledge and competence. Supporting evidence should be selected by the candidate. It needs to be based around the learning outcomes and indicative content, and be relevant for each submodule. The evidence should allow the candidate to demonstrate their specialist knowledge and competence in each submodule. It should be specific and relevant to the candidate's in-house practice. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Each submodule also contains reflective statement, which is asking the candidate to summarize their role in the lab in the context with each submodule. How do they demonstrate that they can draw conclusion from what they have learned, reflect on their current practice and how it can change in the future due to gained knowledge? They could think about what is their lab role in context of this submodule. What impacts can their actions have on their colleagues, department as a whole and for the patients? They also need to write a personal reflection on their training in the lab and explain why they chose their evidence. This is very personal to their own circumstance. It should demonstrate their ability to be self-aware when analyzing gaps in their knowledge. They can use it as an opportunity to reflect on aspects of their training, application of their gained knowledge and skills, and how they have achieved their goals. They should think about what their evidence demonstrates, and why they chose this specific evidence for this submodule. Also, they should write about what their training was like when it comes to this submodule and how their practice changed due to their training. Their reflective statements can also be used as a CPD evidence in case they are chosen to be audited by the HCPC. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, animations, pictures, posters, flowcharts, videos, photographs, PowerPoints, diagrams, graphs, infographics, charts. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like a case study, for each submodule. They could use experiments, case studies, annotated results, troubleshooting, controls production, annotated images, risk assessments, glossary, training presentation, certificates with reflective statements, nonconformances, validations, verifications, comparisons, ECHA results, annotated audits, Kappa or Datix, Q&A. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If they like experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the learning outcomes and indicative content in mind when they are selecting their evidence. Learning outcomes that require the candidate to demonstrate something would be ideal for covering with their evidence. And this brings me to the end of today's video. Hopefully you now have a better understanding about the learning requirements for this submodule. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those learning outcomes in mind when selecting questions and guiding the candidate. Bye for now.